India surpassed 24 million cases of COVID-19. Their second wave has been catastrophic, but there is some hope that the worst might be coming to an end. The number of daily cases is starting to decline. International aid is arriving. Canada, for instance, delivered 300 ventilators just this week. And that's not the only help coming from this country. Bhavini Goel is an acute care physician at South Health Campus, a Calgary hospital, and she's been helping people in India learn about COVID, advise those who are sick on when to seek treatment and their healthcare options. And she's doing it all from Calgary, magically, mostly over WhatsApp chats and video calls on top of her day job. Good to see you, Bhavini Goel.
Thank you for having me.
Well, thanks for being here, Doctor. So how did this start? I mean, obviously you were watching things unfold in India. How did this get going?
So I've actually been part of the Child Foundation for a while now, and we actually have a hospital in rural India. It's about 50 kilometers outside of Delhi. So we were actually working on a telehealth project within that community. So when we saw this happen, we had to respond. And my first inclination was actually, why don't I start helping through WhatsApp and advising friends and family? So I started doing informal consults through WhatsApp in the evening once I had finished work and sort of supporting the pandemic here. And then it just sort of escalated. We ended up having many physicians and healthcare workers actually step up, and now we've got a fairly large task force that's working on a formal process to actually get teleconsult services in place, specifically actually for rural communities, because that's where they're lacking a lot of resources and physician supply as well.
Well, I mean, it's just incredible that it starts from you just sitting at home trying to help family to something that is a network and is going to be more formalized. How many people are helping you with this now? And do you have a sense of how many people you have been able to help?
So right now we have close to 20 actually on our task force, and our task force isn't just limited to doing teleconsultation. We've actually been sending out medical equipment such as oxygen concentrators. We're creating COVID kits with algorithms in place so families can take them home and they can actually seek medical attention when they need it. And on top of that, we've now got a home COVID program that we're going to be running in rural villages where we're managing patients remotely, and they essentially take concentrators home as well as our COVID kits, and we can do virtual consultations every 2 days. We're also in the midst of actually helping equip an ICU in a rural part of India, which is part of a medical college, as well as supporting the mental health aspect, because we've seen a number of suicides amongst physicians, one particularly that was in the media about a physician in Delhi. So we think that's a really important part, because we know that this has taken a toll on healthcare workers right now.
Yeah.
In terms of the number of consults, while I've had sort of a dozen plus sort of patients and family members, you often have a conversation on a daily affair. So you can end up having 2 or 3 conversations a night at around 9 p.m. onwards. So yeah, and they just keep rotating. And the question, sorry.
No, I was going to ask you just that. What are the kinds of questions people are calling to? I mean, even in Canada, some people are uncertain. When do I go to the hospital? How bad is this? What kinds of questions are you getting from people in India?
Yeah, we do know that there's a lot of panic right now going on in India. Patients are going to the hospital too quick, taking steroids too early. And so my conversations often are educating families methods around where to seek attention, their oxygen, and then I've been more hospitalized of the lack of have on ground. They're asking me, well, they're in a critical condition, when do I transfer them to ICU, knowing that the ICU bed is an hour and a half away, and there's challenges in that they don't even have a physician on board the ambulance in case anything happens. So we're sitting here making decisions about, do we transfer to ICU now, or do we wait, or is this going to turn around? So those are sort of the type of being right now.
Oh, I think we've frozen Dr. Goel. I think we've lost you, unfortunately, just as you were. I'll just see if you can hear me again. Dr. Goel, can you hear me? No.
Yes, I can hear you.
You can hear me. Okay. Sorry, we're just having a little bit of a trouble with the connection. Go figure that it's harder to talk from Ottawa to Calgary than Calgary to India. But maybe I'll just I'll wrap things up by asking you, what are your concerns about what is happening there now? What more should the world be doing? It's wonderful for you to have this individual endeavor here with other people, but what should the world be doing to support India right now?
So my perspective on this is that we are in a global pandemic. And when one country is affected, we're all affected. I think that it's important that we get as much international aid across, such as oxygen supplies, ICU equipment, medication. Often, India supplies a lot of these things around the world, but the demand just can't keep up right now. So for me, it's more international aid and collaboration on how can we not only supply, but how can we also support these communities with manpower.
I know you've been to India before. Is it does it help you to know that you are doing what you can to help right now?
It does. I mean, this is absolutely heartbreaking for me and many individuals to watch. I mean, I have a special place in my heart for India, and I see myself as a drop in the bucket. The population's 1.3 billion people, and I'm just a drop in this bucket. But as we add more and more drops, eventually this bucket's going to become full. And I will do whatever I can, but I just can't imagine what the healthcare workers are going through right now. It's just awful.
All right, Dr. Bhavini Goel, you're doing incredible work. I'm sorry we had a little technical breakup, but we did get to understand what you're doing and how hard you're working, and I applaud it. Thank you so much.
Thank you so much for having me.